Can an artificially intelligent language model hold its own against a real dentist with years of training and real-life clinical expertise and experience? Alright, I mean, at this point I think everyone knows about ChatGPT. It's blown up in the news, everyone is seemingly talking about it. Now, you might not know the specifics of what it is or how it works. So very briefly, it's a language model that's been trained on a huge corpus of English text. And we're talking in the order of like 500 to 600 gigabytes of raw text. And it learns patterns and relationships in the data, and it can generate new text that is similar to the input it was trained on using machine learning. And you can interact with it. You can chat to it. So it's all very cool. But there is one burning question that remains. Is ChatGPT on point when it comes to odontology? Does it know its dentistry? And will it impress me? So let's get to it and find out. Alrighty then, I am all logged in and you're in trouble now, son. So let's see if I can make you jump on one leg and have you answer me this. So let's start with something simple. Caryology. I couldn't help but think of you. Okay. Briefly summarise the etiology of dental caries and how it can be treated in one paragraph of text. Beneath that paragraph, create a bullet point list for 3 strategies that can be implemented to prevent dental caries. Alright, so let's see what we get. Alright, it's off. Dental caries, also known as tooth decay or cavities, is a bacterial infection that results in the destruction of the hard tissues of the teeth. It is caused, is this thing fast? It is caused by the buildup of plaque, a sticky film of bacteria that forms on teeth, and the acid produced by these bacteria. The acid erodes the enamel and dentine of teeth, leading to the formation of cavities. The treatment for dental caries involves removing the infected tissue and filling the cavity with a material such as amalgam or composite resin. Good. Not sure about the amalgam. Greta sheds a tear. But good. 3 strategies that can be implemented to prevent dental caries include daily oral hygiene practices, such as brushing teeth twice a day with fluoride. Ding, ding, ding. Mentions fluoride. Fantastic. Next point, limiting the frequency and amount of sugary and acidic foods and drinks. Yeah, I mean, that is the single most important strategy that anyone could implement. Regular dental checkups and professional cleanings to remove plaque and detect caries in their early stages. Yes and no. Going to the dentist regularly would indeed be a good strategy, but professional cleanings to remove plaque? Nah, I mean, that's not going to stop dental caries anytime soon, Sonny Jim. But yeah, I mean, we are most certainly off to a good start.
Stand on one foot. Yes!
The etiology was indeed summarised briefly into one paragraph, and the 3 strategies it suggested to prevent caries, broadly accurate, yeah, but they did contain the odd superfluous detail or 2. But yeah, and swift, it was fast, lightning fast. So yeah, I can't help but be impressed. Alright, let's ask it a new question, and let's change the topic. This time I'm thinking endodontics, which is a field that is far easier in theory than it is in practice, or at least it is to me. So I'm thinking something hands-on, practical, procedural, like a step-by-step guide to doing a root canal treatment, something like that. So let's craft a question, shall we? Root canal therapy, RCT, can treat apical periodontitis. Please write a step-by-step description for how the procedure is carried out by a dentist. And let's add something else as well. In addition, specify the prognosis for this treatment. There we go. All right, let's see what it comes up with. All right, it's off. Root canal therapy, RCT, is a procedure used to treat infection or inflammation of the tooth's pulp, which is the soft tissue inside the tooth that contains nerves and blood vessels. The procedure is usually done by a dentist or endodontist, a specialist in treating conditions of the tooth's pulp. Right, so it gave us an introductory paragraph, which, if I'm going to be honest, is quite broad. I asked it to hone in on apical periodontitis, and yet it's telling me that RCT can be used to treat pulpitis, that is to say an inflammation of the tooth's pulp, which is redundant information. But hey, it's an introductory paragraph. It's okay that it's broad. Nothing in there is factually inaccurate, so I think I can let it slide. Let's get on to the step-by-step and have a look what it says. Okay, so the first point. Local anesthesia is given to numb the area around the tooth. Yes. And I like the wording, it's quite perceptive. Numb the area around the tooth. You're not actually anaesthetizing the actual tooth since it's necrotic, but what you are trying to do is anesthetize the surrounding tissues, because you're going to apply a clamp, which is sometimes placed on the gingiva itself. And the clamp can also apply a lot of pressure to the tooth, which can be of discomfort for the patient. So yeah. The first point is accurate. The next point, 2, an opening is made through the top of the tooth to access the pulp chamber and root canals. That's correct. 3, using small instruments, they're referring to the files, the dentist removes the infected or inflamed pulp from the pulp chamber and root canals. There's an inaccuracy here. Inflamed pulp. The tooth's necrotic, so the pulp is not inflamed, but rather infected, so that's inaccurate. And they've missed a step. In fact, they've missed 2 steps. They didn't mention that you're supposed to isolate the tooth with a rubber dam, but they sort of inferred it in the first point. And secondly, and crucially, they didn't mention, I don't know why I'm saying they, ChatGPT didn't mention the importance of establishing a working length. Which is done using an apex locator or by taking an x-ray with the file still within the canal. Did not mention that, and that's vitally important. So that's problematic. The 4th point, the root canals are cleaned, shaped and disinfected. That's right, but it's not, let me just check further down in the answer. No, it's not mentioning irrigation. Part of disinfecting the canal entails using irrigants, and it hasn't mentioned that either. 5, the root canals are filled with a material called gutta-percha, which helps to prevent reinfection. Yeah, I'd like to elaborate though and add that you're supposed to try in the gutta-percha first and take an x-ray just to make sure that it actually reaches the working length before you finalize it. And you also use sealer. You don't just place the gutta-percha within the root canal. You need to seal it in there. So there's yet another inaccuracy. 6, a temporary filling is placed in the opening and the tooth is sealed. 7, after the tooth has had time to heal, usually a week or 2, the dentist will place a permanent filling or crown on the tooth. Yeah, this sort of flows into the previous point. RCT is typically a time-intensive procedure, so you might not have time to place a permanent filling or prepare the tooth for a crown. So that's correct. Not bad at all. Let's move on to the next part of the answer concerning the prognosis for RCT. The prognosis for RCT is generally good. The success rate for RCT is about 90 to 95%. Yeah, I want to remember from dental school that it's around 86%, so that figure's in the ballpark. It is important to note that after RCT, the tooth may become brittle and may need to be restored with a crown to protect it from breaking. It's also worth noting that after the procedure, the tooth may be sensitive or painful for a few days, and it's not uncommon for the tooth to be swollen or to have some bleeding from the gums. But these symptoms should subside within a few days. If they don't, or if they get worse, you should contact your dentist. Those last 2 paragraphs were very succinct and well written. And, the more I think about it, there are gaps, glaring gaps in the answer. Like, it didn't specify that you're supposed to dry the root canals before you put the gutta-percha in place. Like little details like that are missing. So that's a problem. All right, what I want to do now is test the knowledge base of ChatGPT because it's clearly knowledgeable, but can it answer, like really obscure dental questions? Let's change the topic again. I'm thinking surgery now. What could we ask it? All right, let's ask it to compare different nerve blocks. Outline the main differences between these two nerve blocks used in dentistry. Let's go with the traditional one, the inferior alveolar nerve block, and let's go with an obscure one, and the Vazirani-Akinosi nerve block. All right, let's see what it has to say about this. Okay, the inferior alveolar nerve block, IANB, and the Vazirani-Akinosi, VA nerve block are two different types of nerve blocks that are used to numb the lower jaw in dentistry. Yeah, that first sentence is correct. The IANB is the traditional technique. Yes, it is. It's the Halsted technique, and it's the traditional one. That's right. And it's used to achieve anesthesia of the mandibular teeth and the lower lip. Yeah. The injection site is located at the base of the second premolar in the No, it's not. The injection site is not the base of the second premolar in the mandible. That's describing a mental block. That's completely wrong. What a shame. All right. The VA nerve block is a newer technique that has been shown to provide more effective and rapid anesthesia of the mandibular teeth. The injection site is located at the level of the No, it's not. The level of the mandibular first molar. No, it's way higher than that. It's like adjacent to the maxillary tuberosity. So yeah, I mean, it's just muddled up the administration sites for these two nerve blocks completely. This technique is considered safer and more comfortable for the patient. Yeah, it is more comfortable. I suppose it's generally used when the patient can't open their mouth and they have trismus. So yeah. In summary, the main difference between the two techniques is the location of the injection site. That's true. The IANB is given at the base of the second premolar, and the VA nerve block is given at the level of the mandibular first molar. Completely wrong. The VA nerve block is considered to be more effective and rapid, while the IANB is a traditional technique used in dentistry. Yeah, that last sentence is correct. Yeah, I think I have read some studies that comparing the efficacy of these different nerve blocks, and the VA is generally more successful than the traditional Halsted technique. But overall, I mean, this was an epic fail for ChatGPT. I mean, it just completely fudged the injection sites. What a shame. I think this question really highlights one of the potential pitfalls with using AI and language models like we see with ChatGPT, because it's clearly not conscious. It doesn't know what it's saying. Obviously, it's using predictive models, looking at the words that it just wrote and predicting what word, given the prompts you've given it, would be most likely to occur. And you can oftentimes get answers like we've seen that are really well written and convincing, yet within the answer there are these glaring inaccuracies. So you have to be careful. You have to be very careful. You can't trust this blindly.